Welcome everybody to Prime Time for Women. This is our 10-week series where we get to explore the inevitable changes of life. As women, we are successfully navigating life's journey. Sometimes we struggle, but today and each Sunday for the next 8 weeks, we will highlight a woman who inspires us by the way that she navigates change and the way that she helps others do the same. So today we have Dr. Rachel Day with us, and the topic is everything you ever wanted to know about Botox, fillers, and non-invasive cosmetic procedures. We picked this topic because we all know that as we grow and evolve and change over the course of our lives, so does our skin, right? I mean, my skin's definitely different than it was 63 years ago. If you've ever wondered about using fillers or getting Botox or having laser procedures, you're not alone, and you're in the right place for today. With so many options to look younger and healthier and so many different cosmetic procedures, ever increasing places where it's offered, variety of cost, it can feel a little overwhelmed. But I think this is why I'm excited about this, because Dr. Day joins us today as a fellow of the American Academy of Dermatology to answer our questions, debunk myths, and empower us to live and age gracefully while staying true, I think, to our own vision of who we are and how we see ourselves. Dr. Day has a very interesting medical practice model. She calls it her purposeful partnership. And she takes pride in her ability to help her patients achieve their skincare goals, not what somebody else says they should be doing. Before we do that, I just wanted to tell you a little bit about Dr. Day so that you can see for yourselves that she's the kind of person whose holistic approach to patient care is based on her own journey of self-discovery. So Dr. Day, I'm gonna change this view and put it on speaker view so that you're there, and just get you to tell us a little bit about, I think, your journey from perfectionism to really the kind of self-acceptance that you also offer to your patients.
Thanks, Bernadette. So, and when I was on your show, we kind of talked about how easy it is to seek external validation and, thinking about how we're rewarded. So for me, that growing up looked like, excelling in athletics or throwing myself into schoolwork and achieving at high levels, medical school, dermatology residency, and ultimately landing in practice. And there was something that was just kind of incongruous with that external validation and then an internal acceptance of what are my values, right? And the more that I was willing to get to know myself and to figure out, what do I really care about? What brings me joy? How do I like spending my time? The more that I realized that being in the medical practice setting that I was in initially out of residency, it didn't really resonate with what I felt my mission or my gift to give and to serve was as a physician. So you kind of hit the nail on the head with purposeful partnership. So in my practice, it's a direct care model. And what that means is there's nothing between me as someone's doctor and my patient. There's nothing that, limits our ability to really go into all of the aspects of someone's skin and everything that's underneath it, your physical health, your spiritual health, your emotional health. And especially in dermatology, that carries so much weight. I mean, how people see us in the world and reflects how we see ourselves in the world. So if you're seeing that it's, important to look a certain way or to dress a certain way or to be a certain way, it can feel really challenging if you are not that way. And specifically relating to the topic today, cosmetics and, minimally invasive procedures, I think that should come from a place of celebration because there's nothing that, I'm going to do as a procedure that's going to change how you feel about yourself. So that's kind of the starting place. And that's the foundation of really my practice is that it took a while to get to that point, and it's an evolution, right? We're always trying to get to to know ourselves better. But I don't think of it as cosmetics as a commodity, right? It's really a relationship that's longitudinal and an evolution of like, how do you want to continue to see yourself in life and feel really good about that?
Yeah, and Dr. Day, I know that I've heard you when you were on the program, you were saying that it is your intention and your desire and your goal to help women find the skincare that helps them reveal the inner beauty and that they are, so that they age gracefully according to their own visions, right?
Yeah, you know, medicine is a business, products are a business, and people make money by creating confusion, right? If you feel like you don't know what to do when you go up to a makeup counter or, you know, beauty counter that has 10,000 skincare products, there's like the paralysis of analysis, like, where do I even start? And so I like to just demystify it, right? Let's start with the basics. And skincare is really, really basic. I hate defaulting to this, but like it is so much easier to prevent starting early with sunscreen and sun protection. That's so unsexy to say that, right? That's not the answer that anyone wants to hear. And it's not something that I did, you know, forever, but I started when I was in residency and I wear sunscreen every day. And I think it has tremendous value because it's a small act of care, right? It's saying that I care enough about myself and my skin to just do that little act, right?
Right.
And so, yeah, so skincare can be super overwhelming, and distilling it down to like very basic nuggets is what I hope to do.
And I think it's not just the skincare products, but there's also, you know, my mom's generation didn't have access to like the high-tech light devices or chemical peels or laser treatments or Botox or any of that, dermabrasion, all those things. And so, you know, not everybody knows what they want. They might know what they want, but they don't know what procedure or product will help them get that. And is that something that you're really focused on? What kind of questions do you ask your patients to help them with that?
So first, just foundational, you know, what would make you feel like the best version of yourself? And I don't like to entertain the question, what do you think I should do? Because again, that's an external thing. It really should come from the inside out. So like we had talked about foundational skincare, right? How are you preventing? What are you using for protection? And then how are you starting, like retinols, for example, how are you doing correction? When it comes to procedures like Botox and filler, a lot of times someone will say, I want Botox here. And Botox paralyzes muscles. So, you know, there wouldn't necessarily be a reason to put Botox there. That's really more of filler or volume restoration with procedures. So I think talking someone through how the face ages, what we expect to see, and then how do we dynamically correct those changes that happen over time, and explaining where each thing fits as a piece of the puzzle, that's what happens in a consultation. So a lot of times what someone thinks is the treatment for the concern that they have is not actually the first treatment that I would offer or say is going to meet that need.
Right. So there's a little bit of confusion out there, but people talk about cosmetic procedures and cosmetic medical procedures. Are they the same thing, and who does these different procedures?
So within the cosmetic sphere, I would say there's medical treatment and then surgical treatment. So I would consider, you know, cosmetic treatment, cosmetic medical treatment to mean the same thing, not cutting the skin, not surgery. And then within that, having like a medical professional, like a physician, nurse practitioner, physician assistant, versus an esthetician, I would say that's like the divide within medical and just, you know, like a cosmetic procedure.
Okay. And what questions should people come? You know, not everybody's going to get to Dr. Rachel Day's practice because we have women coming from all over the place to watch this. So what questions should people be asking their dermatologists when they go in? I'm sure that there's some clear things that would help them discern if this is the right place for them, if this is the right procedure? What do they need to know?
I think it's about the longitudinal journey, right? So you want someone who's going to have your endpoint in mind as they're guiding you through this treatment process. And it comes down to the what's, right? What's your goal? The how's, what are, how does that happen? And then the why not, or why should I be doing it at this time? And some things are, I would be leery if it was more of like a transactional, like you schedule to get Botox, you get Botox and leave, because bouncing around makes it much more challenging for someone to keep your goals in mind. So I think getting a sense of what that cosmetic provider's philosophy is for long term is going to be the most rewarding relationship for both, the patient and the person providing the procedures. Because I love seeing that. I look forward to seeing patients that are just, come in with confidence, come in with their head high, can notice those incremental changes. And you look at a picture from 6 months ago and they're like, wow, I just feel so much more refreshed. Like people are saying, what are you doing? And it's not that you're a different person. You just feel like you are walking that path to just have more confidence.
Right. And Dr. Day, just to let our participants know, you talk about overall health and not just how you look in your face, but how you feel in your body. You also talk about emotional and spiritual well-being. And that's a big part of how you relate with your patients, but also how you engage with your community. You're super involved in your community. Your website has tons of articles about nutrition and food and recipes, because you see the connection between all of those. Is that something that is part of the purposeful model, a purposeful patient model?
Yeah, when I think about the Hippocratic Oath, everyone quotes first do no harm, right? I look at that with such a critical lens, and I think of harm to self, right? And then obviously harm to patient. And we're in such a challenging medical atmosphere that I think, we know that the rates of physician suicide are very high, right? The rates of burnout are super high. And it's because we, as a medical provider community, don't prioritize moving our bodies, finding that spiritual connection, emotional safety place. And so if you're not showing up whole to take care of someone, how can you expect to do your best? And so I really, for me, have set up the practice so that I can honor that in myself. And I want the opportunity to share that with my patients, because I don't think that the sort of run-of-the-mill dermatology practice really offers that, or it's not as seen in the medical community. And that's the only way that I would want to practice. So if I'm thinking about it for me, I'm certainly thinking about it for my patients.
Okay, that's great. So that's a really good place to now ask some specific questions that were submitted by people in advance of today's program. And then there could be some follow-up questions at the end if you'd be willing to take those. So the first question is, how safe is it to inject Botox into my face? I mean, could be scary, at least based on what we think Botox is, something that paralyzes.
Yeah, so quick rundown. So neuromodulators, Botox, both as a product and now a procedure. What it does is it paralyzes muscles. So the absolute worst case scenario is that it paralyzes a muscle that leads to an eyelid droop or a lid droop or, a mouth droop, but it's all reversible. So in 3 months, sort of on the long end, it would work its way out of the body. How to avoid that? Obviously going to someone who knows the safety landmarks. But Botox is a very safe procedure overall if you're with an experienced provider.
Okay, and then the next question is, if you don't like your fillers or your Botox, do they both last the same time, and are they both reversible?
So Botox is not reversible. The only thing that will cause it to go away is just time. So the muscle metabolizes the medication and then the muscle can activate again. Filler is really where you want to make sure that both the technique is safe and that you're with someone who's experienced, because there can be significant complications from filler. Filler takes up space and it's injected with a needle or a cannula. And in a very, horrible case scenario, if you inject into a blood vessel, you can have parts of the face lose circulation and die, basically. So you can have necrosis, is what it's called. And that's very significant for individuals that have had that experience. And I saw that through training a few times, and it's horrible. So that is like, for sure, you want to go to someone who knows what they're doing. Filler can be undone with hyaluronidase. It depends on the type of filler, but there are treatments to reverse the filler. And, but you want to go like, start low and slow. I wouldn't go in and be like somebody telling you need multiple syringes or this, that, and the third. You just start very slowly. You can always build from there. But making sure that you have an idea in mind of where you're trying to go, for example, is really important.
Right. Okay. And I'm going to read this question here. It's a long question. What treatments and products would you recommend for me? Does it depend on my past history? And would you rather recommend products as opposed to procedures? And I guess it depends on the patient, right?
Yeah, so everybody's skin environment is a little bit different. So I like to approach skincare. We talked about the core four, right? So prevention with sunscreen, a second layer of prevention with an antioxidant, a reversal with retinol, and then barrier repair is what I call that fourth variable. And that's what's really unique to each person. If you have more acneic skin, you're going to need a moisturizer that's less heavy. If you're dry, just making sure that your skin environment is prepped to be able to use that skincare regimen. And that's across the board, anyone. When it comes to, a product or procedure, it really depends on what are we treating? So for example, acne, which is very common both in our teens, but I see a significant portion of women over age 30 that have acne and struggle with that balance between hormonal acne and, the dyspigmentation that can happen, the painful cysts. So to me, we need to get the medical treatment of acne on board. And then we're really dealing with the cosmetic optimization of the skin that is healing in the setting of acne, right? So the brown spots, if there's any, divots in the skin. And so that may involve procedures like a chemical peel to lighten some of those spots, or a laser to decrease inflammation. Certainly if there's scarring, once the acne is under control, microneedling or laser resurfacing to address those volume deficits. But first and foremost, we have to get the acne under control so that, we're not chasing our tail.
Right. Okay. Oops, I lost you there for a second. Dr. Day, what is, do you think that mostly what we see as skin and normal aging is really just sun damage? How much of what we consider aging is a result of sun damage?
So aging is twofold. We have our intrinsic, like we hope every day to get a little bit older, and then extrinsic, and that's going to be 99.9% from the sun. And so, yeah, most of the aging process has to do with sun. Other things such as, smoking, or if you have other exposures will contribute, but the sun is going to be your number one cause of aging.
Okay, and here's another question. Can diet play a role in improving the quality of my skin?
Yes. So there's a lot about sort of the anti-inflammatory diet, or just what we're consuming. And when you're in a pro-inflammatory state, your skin's not going to have, meaning eating a lot of fried foods, or dairy can kind of fall into that as well. Your skin is not going to be able to combat the inflammation that the sun creates. So if you have a pro-inflammatory state on the inside and then you have something from the outside that's creating more inflammation, its ability to recover from that sun damage is going to be slower. Its ability to heal itself is going to be slower, and it may actually bring out more in the skin.
Okay, and we just got a question in the chat. I'm going to put this to you so I don't forget. The question is, do you deal with hair thinning? Is that something that you do in your practice?
Yes, we do a lot of, I do a lot of hair stabilization and restoration, especially in the wake of what we all experienced in 2020. You know, that was a huge trauma to the world. And what I explain to our patients is systems that consume a lot of resources, like our hair, right? Our hair needs a lot of resources to grow. Our skin needs a lot of resources to turn over. Our gut turns over and has a high metabolic rate, suffer when we're experiencing stress. So I don't think there's anyone who wasn't stressed in 2020. And one of the things that can happen is you can have an acute hair loss related to stress, and then it may reveal some underlying changes related to hormones. So I do manage hair loss in the practice and have lots of options for that treatment.
Okay. I have some questions here about laser procedures, chemical peels, and the question is, do they do the same thing? How long do they last? And what is the cost range of those two procedures?
So I'm going to start with the skin has 3 layers. We have our top layer, which is the epidermis. Which has keratinocytes, those are the main cell, and our pigment cells and melanocytes. The middle layer is our dermis. That's where all of our collagen is, right? That's like the meat of the skin. And then we have the fat. So chemical peels and laser, what they do is we are creating controlled injury to the skin down to a certain level. So it can be top layer, middle layer, deep middle layer. Those are the 3 options. And with a chemical peel, it's a chemical injury. With a laser, it's a heat injury. And the same way, if you cut yourself, right? Cut yourself on your arm, your body's going to work to heal it. And what it produces when it's healing is collagen. And collagen is what we lose over time, in addition to kind of our bone resorption and other areas. But the goal is going to be to stimulate collagen production with a chemical peel or with the laser. So yes, we're creating injuries that we're hoping, or we're expecting the body to then heal and bring new skin and new collagen. Mm-hmm. And so in terms of a cost range, you can have a chemical peel of anywhere from like $100 to like $900, depending on what type of chemical peel. And similar with laser resurfacing on the lower end tends to be around like 700, and then on the higher end can be up to like 2,000 for a treatment.
Okay. Let's see. I'm trying to look at these other questions. Who performs these procedures at your office? Do you have all medically trained people, or do you also have estheticians working in your practice?
So I perform all of the injectables, neurotoxin. I do chemical peels. I do most of the laser work myself. I work with a nurse practitioner very, very closely. And so she does one procedure called laser genesis, which is a laser facial. And she'll do some of the lower concentration, like salicylic acid peels for acne. But anything outside of those 2 procedures, I do everything else.
And how about for people who don't come to your practice? Do you recommend that that's something they ask when they go to a dermatologist?
I do. I think it's important, again, that you have a relationship with that person. You're trusting them to do something to your face, either to put something in it or to do something on top of it. And you want to feel really comfortable that should something not go optimally, and we all hope that everything goes perfectly, right? But the mark of a trust in the process is that when it doesn't go right? Like, what's the remedy that someone can help you navigate that? And in the best case scenario, when there are delegated procedures, you still have, very ready access to a medical professional, meaning physician, nurse practitioner, physician assistant. If, for example, like a medical esthetician is going to be using the laser, that there's a closed loop sort of delegation, and that the quarterback is definitely involved with what's going to be happening in the treatment room.
Okay. And then is there a difference between microneedling and what is microneedling and how does it differ from photofacial?
So microneedling is, it comes in a pen form, but it's got needles on, like, depends on which device, but basically needles on one end that rotate and puncture the skin anywhere from 120 times per second to, like, I think my device goes up to like 165. And what that does is it's mechanical injury to the skin down to the level of the dermis, which is that meat layer. And it creates an injury that then produces collagen production. It can also be used as a drug delivery system. So creating, again, holes in the skin that then you can put something on top of, like platelet-rich plasma, for example, is one that I do quite frequently. And that PRP has growth factors that further enhance the production of collagen and can help with pigmentation, skin tightening, and all of that. And then a photofacial is typically referring to intense pulse light, or IPL, and it's multiple wavelengths of energy that will get stuck at different layers, really superficial in the skin. And the primary goal of an IPL is to help address any redness or brown spots.
And so that's a kind of laser, but it's different than the laser treatment, right?
So laser is actually an acronym. So by definition, a laser is only going to have one wavelength, and IPL is a light source. So it's not a laser. It has multiple wavelengths that go out, and so they'll each get stuck at a different layer in the skin. And so some of them will really target, red spots, and some of them will target light browns. Some of them will target dark browns. So it's sometimes sort of generally referred to as a laser, but it's technically not. And so IPLs are really only safe for fair-skinned individuals, and someone of my skin type and darker, it should be used with extreme caution because you can get burned pretty easily because of the amount of pigment that's just normally in the skin. So I don't use an IPL in my skin. I use a laser that's a wavelength that's safe and penetrates past the level of where all the pigment is at the surface to do any of the work.
Okay, well, that's a good explanation. And then I have one other question here, and then we're going to talk about some products, because it does seem like the more you talk, there's more opportunity for us to do some prevention and also to do some work at home with these different products. But the last question here is, there's a lot of talk recently about PRP therapy as a new kind of injectable or filler. I'm not exactly sure what it is, but I thought maybe you could explain it.
Yeah, so platelet-rich plasma, what it is your blood is drawn in the office, and then it's spun down, and there's a separation of the blood components. And at the top, there's this golden layer. It's called, liquid gold, but it's where your platelets are at. And when we take those platelets out and activate them, platelets are the first second, but they assist in wound healing. So they have all of those growth factors that we talk about when you're creating an injury in the skin. Your platelets go there. So we take them outside and we activate them, and again can inject it into the skin to create a better environment for collagen development. We can put it on top of the skin to help with brown spots and healing. But it's really it's the growth factors that the platelets have inside of them. And so it's something that's been used in a lot of different fields. Like in orthopedics, they use it quite frequently for joint conditions like arthritis, for example. And in actually oral surgery is one of the first to use PRP for bone grafts in the mouth. And so a lot of the literature was started there. I use it in the scalp for hair restoration. So it's all about optimizing a person's environment for healing and for stimulating either new growth or collagen, etc. But it's something that we're going to hear a lot more about: platelet-rich plasma, also stem cells, and a few other things that are coming onto market.
So is the PRP way safer because it's using your own body's defense system to heal your own body?
Yeah, I mean, it is all you. So there's nothing. I like PRP a lot, and I think I just turned 35, but and I say that, yeah, I say that like proudly and very, very comfortable with being in my mid-30s. But we've been doing filler for long enough that early adopters, like 20 years ago, where you just do the hyaluronic acid, years and years and years, it creates like a dysmorphic look to the face because it's not a natural substance that's in the skin. It's one that we produce, but it's artificially made in the lab. So I've become much more, I'll say, leery for my own maintenance, defaulting to filler. And I prefer to use like PRP because it's just me, and then device-based procedures, and sort of supplement that with hyaluronic acid.
So is there a hierarchy of procedures, like you start here and then if that doesn't work, or if you don't like the results, then you go to this or go to that? Or is it all dependent on each person's skin condition? And yeah, I understand the question, you know.
Yeah. Like, do you start here and then you kind of march through?
Yeah.
A lot of the treatment plan, I will say 99% of the treatment plan is budget, right? Like, how can we optimize and stay very comfortable in a space and meet the highest level of the goal that we're trying to achieve? Because again, none of us need any of these things. And the worst case scenario is, you wind up in a store and you can't afford anything and you're like feeling really uncomfortable. And then how can you enjoy that experience? You can't. So I think being very clear about what is the comfort level, what is the priority, and then working within that space. And it does happen that, I'm not always able to meet what the desired result is. And I think having that conversation up front and being honest is so important, because, you're going to feel really bad if I'm like, let's just do a syringe of filler. And what you really need to get the correction and the result that you're hoping to achieve is going to require more than one syringe of filler, right? That's not fair. That doesn't really it doesn't set the stage for feeling that we're on this journey together. Right. So I don't consider that lightly, and I always start with, this is all elective. So it should be a gilding the lily process that you feel really empowered to take this step in your health, but nobody needs any of these things.
Right. Okay. And a question in the chat. What do you think of stem cell treatment for under the eyes, plasmocytes, I think?
So stem cells, like I sort of touched on, newer to the market, but still so it's a very mixed information out there. There's no standardization. I would say I do carry a couple stem cell products in my practice. I use them as adjuvants to microneedling. So one has a lightening agent plus the stem cell called tranexamic acid. So I tend to use that for patients that have dyspigmentation or melasma specifically. And I find that in my hands, I like the PRP better. The difference is that with the PRP, I can both inject it and put it on the surface of the skin. With the stem cell products that I carry in my office, it's just post microneedling. So that would be for someone that doesn't necessarily need or desire to have the injections done.
Okay. Well, I think you've done such a great job of explaining all these different procedures. And I want to kind of pivot to the idea of these different products that can help heal our skin that we can use at home. I just got a chat request to ask. It says there are so many companies touting natural skincare products. I've used the Healthy Living app by Environmental Working Group to try to evaluate products for safety. What do you recommend?
That's a great question. I think the natural products or having that natural label, similar to organic, right? It's trendy to be natural. Poison ivy is also natural, so I would be careful to really see what is working with your skin within our product. Within our practice, I only carry 2 skincare lines, Sente and Skin Better, and mostly because I'm not a skincare junkie. That's just not a space that I want mastery in. And so I've chosen 2 lines that I agree with the ethics, what they're putting in the products, what they aren't putting in the products, and the results. And so I use those in a combination. I think we are way too afraid of like parabens and things that there isn't a one-to-one from industry, environmental industry to like on your face. So my products happen to be paraben free, but I feel like paraben is one of those buzzwords that people are like, we can't have paraben, or we can't have certain things. So the desire to be environmentally conscious and to have like all natural ingredients is a personal choice. And I would say testing within the different lines that meet those personal preferences is going to be the best way, because it's an overwhelming number of skincare products, and it just comes down to like, how do you like how you feel with it? Are you seeing results? Do you know what to expect? But
okay. I have another question in that vein. There is like products that are dermal repair creams and dermal repair serums, dermal repair lotions, dermal repair washes. I mean, what is the difference between all these? Do they all do the same thing? And is it really more of a marketing thing to try to get people to buy multiple products? Or is there really a difference and we need to know this?
Of course they're trying to get you to buy multiple products. Sorry.
I appreciate your honesty.
Yeah, of course. Again, confusion creates, when you confuse someone, then you can come in and be the authority, right? If everybody walked in and they knew exactly what they needed, it wouldn't make as much money. So dermal repair, that designation, is just talking about, again, the epidermis, the dermis, the fat layer. So all of the action in volume loss during aging is happening in the dermis, right? All of our procedures that are related to skin health and rejuvenation, they're activating our collagen. And so like the dermal repair cream from Sente, for example, their proprietary ingredient is a glycosaminoglycan. It's basically a big protein that brings water to it. And this big protein sits in the dermis. So we want our dermis to be full of water so that our face doesn't go like this. Whether it's a serum, whether it's a lotion, whether it's a cream, that's the vehicle, right? So like, how is it getting to the place that it needs to be? Is it going to be a liquid, lotion, cream? And vehicles, how you choose them, depend on your skin environment. So someone who has very active oil glands, right? Like me, like I'm like an oil slick on most days, and that's okay. I am not going to use a heavy cream, right? That's just going to totally like give me way more than I need. On the other side, someone who is bone dry, they're not going to choose a vehicle that's in a toner or that's in a, thin liquid, because that's just going to add dryness to a surface that's already dry. So the vehicle, or, plus like, where's it trying to get to?
Okay, and I'm going to try to read this question in the chat. It says, hyaluronic acid is all the buzz right now in commercials and ads, many expensive. Can these really work when used as a gel? Well, it's hard to read that. So I think they're asking about that
Hyaluronic
acid.
Yeah, so HAs. Hyaluronic acid, medical grade, that's what most of our fillers are. And so taking that and putting it into a topical form, right? So it brings water to the skin, and it certainly is a great product. There are many of them. I would say, like, knowing what it is that you're trying to treat is helpful. So HAs specifically are going to be hydrating products. So again, for me, if I'm very oily, so I don't really use HAs, right? If somebody's really dry, that can be super helpful for restoring your skin barrier. And that might be the fourth part of your core four, right? Yeah. How are we keeping that skin environment resilient so that when we give you a retinoid at night, you're not turning out all like red and flaky? And so you can only use it once a week. You're never going to get the benefit of a retinol if you can only use it once in a while.
So that reminds me of an article I read, and it sounds a little bogus to me, but it was saying how women in their prime, need to drink 64 ounces of water every single day to hydrate their skin. And I'm thinking, aren't we just going to pee that right back out? But I don't know. What do you think about that?
So your internal state of hydration is different than your skin being moisturized. So your kidneys are the regulators of how hydrated you are. All you have to do is like look at the toilet after you pee and you will know, right? So if it's super yellow and very concentrated, that means that your kidneys are working to hold on to water because you may not have enough, right? If it's super clear yellow, you know that your kidneys are releasing water because they feel like it has enough in your body. Your skin, you can be perfectly hydrated on an internal state and have bone dry skin, right? Have no moisture in the skin. You see it all the time. And the moisturization of the skin is related to something called transepidermal water loss. And what that is if you think of the skin like a brick wall, right? Our skin cells are the red bricks, and then the mortar are things called ceramides and other peptides, proteins in there. When that mortar gets run down, right, and gets broken up, your skin cells start to fall out, right? And then it gets dehydrated and it can't hold in the water that's supposed to hold in. And so it dries out, and it's just like a one-way street. That's where HAs or humectants, other moisturizers, you just put that on as like a seal. So you're sealing that brick wall so that you don't lose water from inside the skin, and you can maintain a moisturized skin barrier.
All right, this is so, I am not sure about everybody else, but I'm like, this is such great information. And just like we kind of advertise this, everything you wanted to know, and it is everything we want to know. We have some more questions coming in. What do you think of Lifeline skin products? And you've talked a lot about collagen. Should we ingest it, use it topically, neither, or both?
So to the Lifeline skin products, like I said, I don't get up in the morning for skincare, and I hate having to really make that confession as a dermatologist, because I feel like you're supposed to be like super jazzed about what's going on there. I keep it really simple for myself. And so I don't specifically know about that line. When it comes to collagen, there is no unbiased evidence in the literature that says drinking or consuming a collagen supplement product will have any effect on the collagen in your skin, specifically in dermatology. If we're talking about joint health, joint preservation, there's definitely objective data for using collagen supplements to help the joints, but not in the skin. So I don't routinely recommend collagen supplements specifically for like an anti-aging regimen or anything like that.
So Rachel, tell us what your beauty regimen is, just to kind of give us an idea of what an expert in the field does. And we know it's for your skin and not our skin, but it just, yep, just tell us.
I think that's a great question. So I wash my face once a day. Like I said, I run on the oilier side, so I do use an exfoliating cleanser. What does an exfoliating cleanser do? Right. So exfoliants can either be the mechanical little bead ones or enzymes that help release the dead skin at the surface of the skin. So and dry out some of that oil. So I use an exfoliating cleanser daily. I use in the morning an antioxidant. And what antioxidants do is they protect the skin from the inflammation caused by the sun's radiation. So I think of it as your second layer of defense from the outside in, right, when you're seeing the sun, but the first thing that goes on the skin. So when I get out of the shower, the very first thing I do is pat my skin dry and I put on my antioxidant serum, so thinner, so something that's not, again, going to stimulate more oil for me. And then I put on a very light moisturizer, and then I use a sunscreen that's like a nice lotion sunscreen. That's what I do in the morning. In the evening, if I wash my face, and I don't always wash my face, but if I wash my face, it's going to be just a basic gentle cleanser. And I use Vanny cream at home. It just gives me a very neutral palette. And then I use a retinol at night that also has some exfoliant along with it. And I always put a light lotion on top of that. I have been, noticing my neck. So I'm trying out some HA products on my neck. I haven't necessarily seen a difference yet, but I haven't been using it for that long. And then I will periodically dabble in eye cream, mostly as a function of just whether or not I have a child on my hip, truly.
Rachel has little twins and two.
Yeah, I have 3-year-old twins and a 7-year-old. So everybody gets up somewhere. We just had to be like, you cannot come downstairs before 6. So we get up very, very early. But I keep it simple, and I understand that some of it has to do with not having to really address that barrier part in my skincare routine. So how my routine would differ if you had, active acne or rosacea, which is very, very common in women between the ages of like 35, 65, rosacea comes out later in life and typically is underdiagnosed in general. Like people just assume it's okay to be a little bit red and there isn't anything to do about it, or like some pink bumps that kind of come and go. But I see that a lot where it's not treated. And so you can't tolerate the basic routine because you have that active inflammation.
Okay. And I have a question here in the chat. If you have oily skin when you're young, are you likely to have fewer wrinkles when you get older?
Yes.
Oh.
Yeah, that's why I say I'm not mad about it.
Yeah, that's good to know. And that is just because that oil forms a barrier?
Mm-hmm.
Okay. All right. Please talk about the injectables Wait, I gotta put my
Sculptra. That's a great question. So Sculptra is a suture material that is suspended in sterile water and gets injected through a cannula it's a biostimulatory filler. So what that does is when the water leaves the skin, gets absorbed by the body, the suture material is left in the collagen. And that is a pro-inflammatory thing to be left in the skin. And with that inflammation, it creates collagen to be formed. So it's a filler that is typically used over sessions. So for example, I have somebody who's scheduled for like 2 sessions, and then we will reevaluate if she needs a third one, and then in a maintenance form, like annually. So you don't, it doesn't go away. It's meant as like a progressive treatment to maintain once you're therapeutically corrected.
And this question says specifically to treat nasolabial folds. Is it used other places?
So I don't love treating nasolabial folds. I find that patients tend to be undercorrected in other areas that contribute to the nasolabial fold. For example, I always work top down. When we start out with an inverted triangle, right? We have the highest point being at the tops here of the cheek across the bridge, and the face gets narrower towards the chin. Over time, what happens is the triangle point goes here. We have lowering of the cheeks because of bone resorption, fat loss, and so there's a squaring off of the jaw here. And that's what creates the nasolabial fold, right? We have gravity that's kind of moving in here and it settles there. What happens when you just correct the nasolabial fold is you get very heavy in that mid-face area. So that's always the very last place that I will treat and correct. So I work temples. We want to make sure that where the light shines on your cheeks should be in the appropriate anatomic position. And there's a way of basically drawing out like where that spot is supposed to be for you. And then also, what about the jawline, right? Are you supported here? Because a little bit of filler back here just creates more tenting. And then also in this little solo. So in my practice, it's pretty rare that I treat like the nasolabial folds. It's really like a pan facial rejuvenation. So yes, you can put sculpture anywhere. Temples, cheeks, jawline. It's really nice for rebuilding the jawline. Particularly men right now are looking for like more square off jaws.
Are there any exercises you can do?
I have horrible TMJ. Actually, it's fairly well controlled, but I do think that it helps to do like jaw exercises and stuff like that.
That's so funny. All right, well, there you go. And another question here, do you have any tips for red sensitive skin?
Yeah, gentle skincare and an antioxidant. So I have a theory about why Vanny cream is like really underrepresented. But it's a over-the-counter skincare line that is approved by the National Eczema Foundation. I use their cleanser and light lotion exclusively in patients with sensitive skin and find that it works really, really well. And then for rosacea, or if you just have like some redness, an antioxidant again is going to help decrease the inflammation that the sun brings. If you generally want to follow my practice or where I'm at on Instagram, it's Love My One Skin, and my website is oneskinderm.com. We do telemedicine visits for individuals that are just looking for skincare recommendations or consultations, even if they're not in the state of Pennsylvania.
And Rachel, I did put your website in the chat so that people can reach out to at least check that out. And when you go to Rachel's website, you'll get to see the blogs that she writes that have great tips for different recipes and just overall healthy living, which is one of the things that I really, really appreciate about your total purposeful partnerships with your patients. So just wanted to put that out there.